Jersey?
Yes.
Okay, I'll go with you because I got my horse from New Jersey. Yeah, I bought him out there, and I love it there actually. But I can't stay there either because Kathy needs me to.
I need you here.
I'll just go back when you
That's right. There you go.
I'll pick up a couple more bloods when I'm there.
Callie and Dakota got spayed today, and they got dentals. And Dr. Sturwell was just explaining about Callie's tear duct.
Okay, so this is Callie, and what we had found that she had blocked tear ducts, and so when I went in after she's under anesthesia to take a look at the ducts and flush them, I noticed that she had a little tan plaque, a little bit of a cystic plaque over her actual tear duct. You can see that little white plaque there.
Okay.
It is not able to be catheterized, so I wasn't able to flush this lower puncta, and actually both eyes, okay? It was most significant in the left eye. The right eye had one just starting.
Okay.
But I was able to establish flow through both upper puncta. So I catheterized the upper puncta, was able to get flow. Let's see if I have a picture of that for you guys.
Okay.
And we took a couple pictures of that.
This is so great that you take pictures.
Okay. And this is me flushing the upper puncta, and you can see, let's see, you can see there's green coming out the nose.
So it's clear.
It's still clear. So I would recommend that when she ends up having another dental procedure in a year or so from now, that upper puncta should be flushed again because those are the only patency that she has is the two upper ducts. The lower ducts really aren't patent. I don't think it'll cause a problem for her as long as we keep the upper ducts open.
Okay.
Now for her, she does need to have some antibiotic steroid put in her eyes twice a day for about 10 to 14 days just to keep that from becoming inflamed.
Okay, so this is for Callie.
That's for Callie.
And both Callie and Dakota have bad itchy paws, so they're going to get chlorhexidine pads wiping their paws twice a day, and then a little spray twice a day. Is it allergies or?
Well, most common, parasites are the first and foremost thing that we need to get rid of, and they were treated for fleas. They were treated with a 3-month product. It will help control fleas for 3 months. So if that was the factor, I don't expect that to be a continuing problem. If they do have allergies and they've already been treated for fleas, then we do worry about either food allergy or inhaled allergies. So the first step is the flea control, and that's where we started. They did look like, I didn't get to see them when they first came in, but they did look like they had a parasite issue because they have a little papular dermatitis, which they get from flea allergy. So I do think that they probably were flea infested when they first came in.
Okay.
Yeah. We are going to do a little pain meds, anti-inflammatories for her. She was just spayed for Callie.
Only Callie.
Both of them.
Both of them.
But we're going over Callie right now.
Oh, we're going over Callie. Okay.
And we're going to give her a single dose for a 20-pound dog once a day, starting tomorrow morning.
Okay.
And this will give her enough for about 5 days.
Okay. Callie. Callie's little pile. It's for both of them.
Okay, and for Callie, she also is going on a little bit of oral antibiotics.
Okay.
And this is because her skin definitely had a little secondary infection from licking her paws, and she also had a little bit of dermatitis as well. I also wanted her treated because her skin was in such rough shape when we went ahead to spay her, so I want her covered with antibiotics.
Okay.
So she gets a half a tablet once a day for 14 days.
Starting tonight or
tomorrow morning.
Tomorrow morning, okay.
Yeah. She already got an antibiotic injection today, so she's good. And then we can talk about Dakota. Oh, one other thing with Callie. She does have a lot of dry flakes on her skin.
Okay.
And we did a skin scraping. It was negative for mites.
Okay.
We also did a Scotch tape prep to look for walking dander.
Oh my God,
a lot
lice.
of pets have that, okay?
Okay.
We did a lot of little samples and didn't find any
lice. Okay.
So, woo, we're good.
No lice.
Okay, so I'm suspecting it's either a nutritional deficiency because diet doesn't look like it was adequate. We were very thin, and now that we're on a good diet, I don't think that should be an issue.
Okay.
And if we continue to have this seborrheica, the flaking of the skin, I'd recommend fatty acid supplementation. Okay. And then I'd also recommend deoxyseborrhea baths.
Okay.
Okay. But I think we have major nutritional deficiencies right now, both dogs, because they're thin. They just need adequate nutrition. TLC. Both of them had their stools checked for internal parasites, negative.
Okay, that's good.
Giardia was negative and the fecal.
Okay, that's good.
Okay. And
so now we're
on Dakota.
Okay.
Dakota has conjunctivitis. Both eyes were a little red and inflamed. Okay. And we also have a little pustule on the left upper eyelid. And we had some hair loss around the eyelid margins.
Okay.
And we have hair loss in other
It looked like
areas.
Demodex.
It really looked like Demodex. So I not only did skin scrapings here,
Yeah.
because Rebecca had started doing the skin scrapings for me. I told her to
Right.
go ahead and do the tail area and the perianal area.
Yeah.
She came up negative, and I took her out to take another look. She had a lot of alopecia around her eyes, and I'm like, "Are you sure, Rebecca? I want to do a couple more."
Yeah.
So I did some around the eyes.
No Demodex?
So what I'm suspecting, because the skin definitely looks very, very chronic. It looks like we've been itching and scratching and miserable for a while.
Please.
I think it's a parasitic issue, and I think it's probably the fleas because we've already treated for pretty much everything else.
Okay.
Okay. We had a lot of papular dermatitis over the lumbar area, which is where they always get it with fleas.
Yeah.
Okay. And the anal glands were big.
Oh,
Okay. So that could have been a big part of it.
Okay.
Okay. So we expressed the anal glands. We did do the skin scraping, multiple areas. Did not find any evidence of mites. She was also treated with a Brevecta at the other clinic, so that's a 3-month flea preventative. Make sure to make note of when it's going to be due again.
I did on my calendar already.
Good.
Yeah.
And then for her, she also had a little bit of an elevation in her white blood cell count, and both of them were very close coming out of estrus. So they're very vascular during the spay, but they did totally fine.
Okay.
But what that meant for them is they both presented with mild anemia.
Okay.
And I think it was just because they were just coming off their heat cycle. They lost a little bit of blood through their menstrual cycle.
Okay.
And with her white count was a little bit elevated too. And I attribute that to all that was going on with her skin.
Okay.
So she's going to go on a little stronger antibiotic. She's going to go on Baytrol.
Okay.
And she's going to get 1.5 tablets once a day for 2 weeks
Okay.
with food tomorrow morning.
Okay, that's
Okay.
for Dakota. You got Dakota's little pile there.
Now to take care of her conjunctivitis, and this may also help reduce that little pustule that she has on her eyelid.
Okay.
Little antibiotic steroid for both eyes.
Okay.
Twice a day for 2 weeks.
Okay.
Okay? And that's for her. They're going to share this.
Okay.
And anti-inflammatory for her, pain meds post-spay. She's going to get...
Oh, is that the same as this?
It is. I split it up
Oh,
for
you just split it up into 2 things. Okay, good.
This is 0.45 once a day, starting tomorrow morning.
Okay.
Okay?
Got
And
it. Okay.
that's everything.
All right.
Okay. One other thing I thought of with Dakota is thyroid.
She had a thyroid test that
She did get thyroid
it was on
tested.
that. It was on the lab work.
I didn't see it. It came back normal.
I think so. Do you want to
Let me
grab
double
it?
check it.
Yeah.
Let me double check it.
Yeah, that's what I thought
Because that
when I
was the
saw the
only
rat
other thing.
tail.
Cushing's is certainly a possibility, but she just doesn't have any other signs. She's not
Like no
distended in
pot
her
belly.
abdomen. Yeah, and she looks thin. So I'll be right back.
Okay.